Welcome to Getting Started on Tyvaso, brought to you by United Therapeutics Corporation.
Hello there, I'm Michelle. I am an employee of United Therapeutics. United Therapeutics partners with specialty pharmacy nurses who provide home visits to make sure you have the information and support you need while starting Tyvaso. Specialty pharmacy nurses can also teach you how to use the Tyvaso device and answer questions you may have when taking Tyvaso. Remember to always talk to your doctor about questions concerning your health and your treatment regimen. In this video, you will see what a specialty pharmacy nurse-patient interaction might look like. I'm going to play the role of the specialty pharmacy nurse. Before we do that, I would like to introduce Donna. Donna is a PAH patient. Together, we will give you an overview of the Tyvaso inhalation system using the TD-300 device. And Donna will tell you a little bit about her experience with Tyvaso and share how Tyvaso may fit into your daily life.
Hello, my name is Donna, and I have pulmonary arterial hypertension, or better known as PAH. It hasn't been easy, but I do not let PAH run my life. I love my great nephew. I take him to the park, I play with him, and I have a puppy dog that I am just in love over. And I like to cook. I'm not afraid to try new things. I was first introduced to Tyvaso by my doctor. Tyvaso fit into my lifestyle so easily, and I liked being able to adjust my treatment around my schedule. Also, the Tyvaso device is portable, so I could take it with me out and about.
Thanks, Donna. Now let's get started with the TD-300 device overview. You are probably watching this video because your doctor has prescribed Tyvaso for the treatment of your pulmonary arterial hypertension. Tyvaso is approved for the treatment of PAH WHO Group 1. Tyvaso can improve the ability to exercise in people who also take bosentan, an ERA, or sildenafil, a PDE5 inhibitor. I would like to remind you to tell your doctor about all of your medical conditions before you start Tyvaso. These conditions can include lung disease or infection, liver or kidney problems, low blood pressure, and bleeding problems. It is important to share this information since these conditions may affect your treatment with Tyvaso. Also, be sure to tell your doctor if you are pregnant, plan to become pregnant, or are breastfeeding. It is not known if Tyvaso will harm your unborn baby or if it passes into the breast milk. Also, be sure to read the full instruction for use manual prior to starting on Tyvaso. You may be wondering what comes next. Donna, do you remember starting on Tyvaso? How was that process for you?
While I was waiting to begin my treatment, Michelle contacted me to make an appointment to go over how to use the Tyvaso. I appreciated that she gave me 2 location options, my doctor's office or my home. I chose to be in the comfort of my house because I wanted my husband to be present for the training in case I forgot something. Just prior to my appointment, I received a box containing all the materials I needed to get started. It included my Tyvaso inhalation system, I call it my Tyvaso device, and instructions for use manual. I remember having mixed emotions. I was nervous, but I couldn't wait to begin my treatment.
Yes, and it's important to remember, even if you're excited to begin your treatment, do not start taking Tyvaso until you have been trained by your specialty pharmacy nurse. This training usually takes about an hour and will give you the information you need to get started. You can think of your specialty pharmacy nurse as part of your healthcare team during this initiation period. This process can be overwhelming at first, so that's why they are here, to help you along the way. Expect your specialty pharmacy nurse to stay in touch, follow up with you regularly, and be available to answer any additional questions you might have.
I can speak to this. I had a great experience. Michelle was warm. She made me feel comfortable with the device and my treatment, and her support didn't stop. After the first day of the treatment, she came back several times to be sure that I was using the device properly and was available to answer questions and provide guidance even after I started my treatment with Tyvaso. I'm grateful for the assistance and encouragement I received from Michelle and my team at my doctor's office. They helped start my Tyvaso treatment journey off on the right track.
Now we will take a closer look at the Tyvaso device. Donna and I went over what to expect as you get ready to start your treatment with Tyvaso. Now we want to share some features of the Tyvaso device. The instruction for use manual provides much more information. It's an important resource to keep handy when taking Tyvaso.
A feature that I found useful is the ability to check my battery status. I do this by setting the switch to run and holding the blue button to turn the device on. The battery icon appears at the bottom of the screen, which can be seen here. The device has 4 different icons that make it easy to track my battery. Every morning I check for battery full so the charge will last all day.
That's a helpful tip to ensure your device has enough power, especially if you're taking it on the go. But just to be safe, you should always take your charger with you when you go out. If the battery is too low to deliver a full treatment, charged battery will appear on the screen. When this happens, be sure to charge your battery. Now let's look at some other features. For example, you can use just one button to power the device on and off and to start and pause a treatment.
Having one multifunctional button really does make things easy. The device also has other helpful features. When I turn the device on, I see an introductory screen, then the time since my last treatment, and then the current breaths program for each dose. This helps me track when I took my last treatment. You may be wondering about how to dose Tyvaso. The starting dose is usually 3 breaths per session. My doctor started me on 3 breaths and increased my dose based on how I tolerated Tyvaso until I reached a target dose of 9 breaths per session. Your doctor will determine the number of breaths that are right for you. A typical treatment session should take 2 to 3 minutes. And remember, you do this 4 times daily.
Remember to contact your doctor or specialty pharmacy nurse if you have any questions about dosing or trouble increasing your dose. This video is not designed to tell you everything about the Tyvaso inhalation system. It's important to refer to your instructions for use manual for detailed information on how to use the Tyvaso device. Your specialty pharmacy nurse is also a great resource for any additional questions you might have. Let's talk about how to assemble your device once daily.
I remember the first time I tried to assemble my Tyvaso inhalation system. I was worried about getting it right. With practice and a couple of calls to Michelle, the process became second nature. It's important to be careful and not to force the parts together. At first, I was nervous about putting the parts together incorrectly. One thing that helped me make the process easier was remembering that the clear and the cloudy pieces fit together. I also like to keep the instructions for use manual handy in case I get stuck.
Here is a quick demonstration of the assembly process. Begin by filling the water level cup with fresh distilled water up to the arrow markers. Pour it into the water chamber. Then place one new empty medicine cup into the chamber of the device. Make sure that the cup's bottom tip is in the distilled water. Now you will add the medicine. Carefully cut open the top of the foil pouch, being careful not to cut the ampules. Remove 1 ampule of Tyvaso and be sure to store the remaining ampules in the foil pouch to protect them from light. 1 ampule contains enough medicine for 1 day of treatment. Even if your doctor increases your dose, you still only use 1 ampule of medication each day.
That's really helpful for someone who likes to stay busy. I assemble my device the first thing in the morning, and then I'm ready for my 4 treatment sessions that I do throughout the day.
Hold the ampule upright and twist off its top. Point the ampule straight down toward the medicine cup center. Gently empty the medicine out of the ampule into the medicine cup. After the medicine is in the medicine cup, assemble your device. First, check that the black ring is securely placed in the dome assembly. Then, attach the dome assembly onto the device by pushing down and screwing it onto the device in a clockwise direction.
I like to think of this step as screwing on a water bottle top. But in this case, I hear clicks or a crunching sound letting me know the dome assembly is screwed on tight and is connected to the medicine cup.
Continue the assembly by installing a new filter membrane in each of the filter shells. Next, insert one filter shell into the filter shell port on the back of the device, and the second filter shell onto the port on the bottom of the inhalation piece. Insert the inhalation piece on the attached filter shell into the upper opening of the dome assembly and rotate it towards the front of the device. Last but not least, carefully insert the mouthpiece onto the inhalation piece. When the device is fully assembled, it should appear like this. See, it's pretty easy when you do it a few times. If you would like a more detailed description of how to prepare your Tyvaso system for daily treatment, take a look at pages 26 to 39 in your Instruction for Use manual. Once you have assembled your device, you are ready to start your treatment. As you get used to the breathing technique, you can use the device cues to help you along the way.
I like that the device gives both visual and audio cues. The device signals me with beeps or green flashing lights when it's time to exhale to prepare for inhaling the medication. In addition, I can follow the device screen to remind me of my next step. It displays the number of breaths left with an exhale or an inhale icon.
You will inhale Tyvaso during 4 treatment sessions each day during waking hours. During each session, you will take the number of breaths prescribed by your doctor. It is very important to keep the device level when inhaling Tyvaso. This will help deliver the medication into your lungs at the proper angle. Be careful not to tilt the device, as this can dispense the medication improperly. Remember, proper technique is crucial to proper dosing. Improper technique may contribute to cough and throat irritation.
When I first started my treatment with Tyvaso, I had to adjust to inhaling my medication 4 times a day. The doses were spaced about 4 hours apart. I found that each treatment session takes me about 2 to 3 minutes. Now I can usually fit a session into most of the activities I plan in my day.
Now let's review a session of 3 breaths. Remember to keep your device upright and level to the floor. This will direct the flow of medicine into your lungs and not toward the roof of your mouth. After you turn the device on, wait until it emits 2 short beeps. When you hear a long beep, exhale in preparation to inhale. When you hear 1 short beep and see the indicator lights flash green, place your lips securely around the mouthpiece and inhale for 3 seconds.
When I first started using Tyvaso, I felt like I needed to hold my breath while inhaling. Michelle corrected my breathing, which helped me relax during the inhalation process. I also found that drinking some liquids before treatment helps to coat my throat.
You nailed it, Donna. I'm always reminding my patients, do not hold your breath while you inhale. You should take a normal full breath for about 3 seconds. Then take your mouth off the mouthpiece and exhale normally. Go at your own pace. If you need to slow down, use the blue button to pause your treatment until you are ready for your next breath. After you complete a breath, you will notice that the screen will decrease the number of breaths left by 1. Donna will show you this inhalation sequence. You should repeat it for your number of breaths prescribed. After displaying your last treatment session, the green Done screen will appear, and you will hear a beep, letting you know that your treatment is done. Once you have finished a session, record the number of breaths you inhaled in your treatment tracker. You can also see pages 42 to 45 in your Instruction for Use manual for a full recap of your inhalation process. Feel free to reach out to your specialty pharmacy nurse if you have any other questions about your treatments or using the Tyvaso device.
I try to keep busy, so it's important for me to be able to take Tyvaso on the go.
Did you know that the Tyvaso inhalation system is portable? You can pack the device in its carrying case and take it with you. Let's go through this process step by step. Start by removing both the mouthpiece and the inhalation piece. When removing accessories, always make sure to hold the device by its base to avoid spilling the medicine. Also, you do not need to remove the filter membranes from the filter shells until after your last treatment session of the day. In addition to leaving the filter membranes in the filter shells, leave the dome assembly and the medicine cup attached to the device. Do not open the dome assembly. The water and medication should remain in the device. Next, place a plug into each of the 2 open holes on the dome assembly. This helps to prevent medicine from spilling out. Keep in mind that if the plugs are not in place, the medicine may spill. If that happens, be sure to start your next treatment with a new ampule of medication, as well as new filter membranes. Once the plugs are in, place the inhalation device and all of its components in the carrying case. Make sure to keep the carrying case upright while you insert the device and components so that the water and medicine does not spill. I recommend taking your device with you wherever you go. Sometimes, even with careful planning, you may be delayed in coming home in time for your next treatment.
I definitely agree. I like having my Tyvaso system easily accessible to take my treatment while I'm out and about. When I know I won't be home for a while and need to use the device on the go, I make sure the internal battery is fully charged. It's a great feeling not to have to worry about finding a wall outlet. I do that enough with my cell phone. However, I always take the AC wall plug with me just in case I need to recharge the device while I'm away from home.
If you need a refresher on how to pack your portable device, refer to pages 48 to 51 in your instructions for use manual. Follow these steps to clean your Tyvaso inhalation system. Once you have completed your last treatment session of the day, remove the mouthpiece and inhalation piece with the attached filter shell. Next, remove both filter shells, open them, and discard the used filter membranes. Once you have removed the dome assembly, remove the medicine cup. Empty any leftover medicine and discard the empty cup. Be careful not to spill any medicine on your hands. If a spill happens, wash your hands immediately. Medicine contact with your skin can cause irritation. After you have removed all the accessories from your device, empty it and let it air dry by turning it upside down on a clean, dry surface. Then clean your accessories.
You may be wondering how I wash and dry my accessories. Initially, I thought I could just wash them in the dishwasher. However, Michelle advised against this. Instead, hand washing them with soapy warm water followed by a thorough rinse does the trick. In terms of drying, I use a drying rack and leave my accessories out on the counter to dry overnight.
A drying rack is a great idea. Donna, you mentioned you had a great end of the day tip to get ready for the next day?
I like to be proactive, and I have found that charging my device at night once it's dry is one less thing to worry about, so I'm ready to go with my first dose in the morning.
Once a week, use a clean, dry cloth to wipe the inside of the inhalation device chamber. Once a month, you will receive a set of new accessories as part of your Tyvaso refill kit. This is when you should discard your old accessories. Make sure you read the Tyvaso instructions for use manual. And if any questions or issues arise, contact your doctor or specialty pharmacy nurse. A number of additional resources are available to you. You can sign up for the Tyvaso support program at tyvaso.com. Once you sign up, you will receive emails with information and tips that can help you along your treatment journey. Another source of support for patients new to Tyvaso is the Peer Network. Go to peernetwork.net or call 1-866-505-6999 7337 to connect with a mentor like Donna today. This network connects you to another Tyvaso patient who can share their experience, give you helpful tips, and offer support in your journey.
I know that starting a new treatment can be challenging, but with the right support system, your doctor, your specialty nurse, and even the peer network, you have a variety of options for getting the support you need as you learn how to fit Tyvaso into your day. Head over to Tyvaso.com to learn more about the support programs and resources available to patients who are on Tyvaso. Thanks for watching.
What is Tyvaso? Tyvaso, treprostinil, is a prescription medicine used in adults to treat pulmonary arterial hypertension, PAH-WHO Group 1, which is high blood pressure in the arteries of your lungs. Tyvaso can improve the ability to exercise. Your ability to exercise decreases 4 hours after taking Tyvaso. It is not known if Tyvaso is safe and effective in children under 18 years of age. Important safety information. Before you take Tyvaso, tell your healthcare provider about all your medical conditions, including if you have lung disease or infection, liver or kidney problems, low blood pressure, or bleeding problems. If you are pregnant, plan to become pregnant, or breastfeeding, tell your doctor. It is not known if Tyvaso will harm your unborn baby or if it passes into breast milk. Tell your healthcare provider about all the medicines you take, as Tyvaso and other medicines may affect each other, especially medicines used to treat high blood pressure or heart disease, or that decrease blood clotting, anticoagulants, water pills, diuretics, gemfibrozil, Lopid, or rifampin, Romactane, Rifidin, Rifamate, Rifitor. Tyvaso can cause serious side effects, including low blood pressure, symptomatic hypotension, and bleeding problems, especially in people who take blood thinners, anticoagulants. The most common side effects of Tyvaso are cough, headache, throat irritation and pain, nausea, reddening of the face and neck, flushing, fainting or loss of consciousness, dizziness, and diarrhea. These are not all the possible side effects of Tyvaso. Call your doctor for medical advice about side effects. You may report side effects to the FDA at www.fda.gov/medwatch or call 1-800-FDA-1088. Please see the full prescribing information, patient product information, and the Tyvaso inhalation system instructions for use manual. For additional information about Tyvaso, visit www.tyvaso.com or call 1-877-UNITHER, 1-877-864-8437.